All right, Simon, thank you. Today's health alert: a Michigan resident has died after contracting rabies through a recent organ transplant. So many people have questions about this tragedy. We don't know which organ was transplanted, but this raises concerns and questions about how donors are screened. Joining us now, our chief health editor, Dr. Nandi. And Doctor, what happened here? Is this unusual?
Yeah. First of all, my condolences, right, to the recipients' loved ones, and the second chance for life for this Michigan patient was tragically cut short. And here's what we do know, Glenda, is that the patient had an organ transplant at a hospital in Ohio in December and passed away the following month. Michigan and Ohio health officials worked with the CDC to confirm that the patient indeed was infected through the donated organ, and no further details have been shared. Now let's talk about rabies. Rabies deaths are extremely rare. We were talking about this before in the U.S., and we usually see fewer than 10 cases per year. Rabies is almost always transmitted through bites or saliva from an infected animal. However, transmission through an organ transplant has happened before. In fact, in 2004, 3 recipients died after receiving organs from an infected donor in Arkansas. And in 2013, a kidney transplant patient died under similar circumstances. Well, this is very scary, right? Please keep in mind that thousands and thousands of transplants are performed every year, with over 48,000 done in 2024 alone.
So the donor didn't show any symptoms of rabies, and is this reason for concern? Or?
Yeah, people are going to be worried about this, right? But rabies doesn't always show symptoms right away because the virus, first, Glenda, has to travel to the brain. Early signs can include the flu, fever, headache, and discomfort. But as it gets worse, it can cause confusion, excessive drooling, and even hallucinations. So, right, the question is, should we be scared or worried? First of all, there are strict guidelines, you have to know this, to make sure that organ donation is done ethically and safely. Every potential donor undergoes extensive screenings for infectious diseases like HIV, hepatitis, or other viruses or bacteria. In fact, a highly accurate test called nucleic acid testing lowers the risk of passing an infection through a transplant. However, testing for rabies isn't standard. Why? Because it would take too long and put the organs at risk. Now, when it comes to risk, patients are fully informed before a transplant, and they always have the right to say no. But waiting, right, comes with a lot of risks. Every day, about 17 people die while waiting for an organ transplant. So at the end of the day, right, organ transplants to me save thousands of lives every year. And while cases like this are very tragic, they're actually incredibly rare. And organ transplants, so many of my patients are waiting for them to be able to give them a new chance at life.
Of course, just trying to live and carry on. So
exactly.
That's a shame. Thank you, Doc.
Of course.
All right. Well, this week on the Dr. Nandi Show, fitness on a budget. See why you don't need a lot of money or fancy equipment to get your exercise on. That's this Sunday at 5 p.m.